Hi folks, I'm Dr. Hassan. I'm at Kare Chiropractic and weight loss. Today I'm going to answer a few very commonly asked questions about the weight loss and weight management, and our lovely assistant Danny is going to help us with this question. Danny.
Can you tell me briefly about semaglutide and tirzepatide and how they work?
Semaglutide and Tirzepatide are revolutionary medicine for weight loss. Both are FDA approved, and semaglutide was approved a few years ago, about 2017. Tirzepatide probably about 2 years ago. They work similarly, but tirzepatide is much more potent. You can lose up to 24% weight in few months. Semaglutide you can lose up to 15% in few months. They both work in various places of the body, in the brain, in the gut. In the brain, what it does, our brain has two centers. One is a hunger center, one is a satiety center. Usually, the satiety center controls the hunger center, so we control our hunger. But over time, that control is gone. So now the hunger center dominates, and we feel hungry all the time. We eat not to just control, not to just suppress our hunger. We just do not know when to stop. We just keep eating it. So satiety center becomes less active. So this medicine activates the satiety center and to regain its control on the hunger center. It also cut down the addictive potential of the eating, because we now believe that eating is a result of food addiction, and it's because it's linked with a very much complex mechanism in the brain, that with the release of the dopamine and doing the same behavior, the same pattern with the alcohol, drug, gambling, all of the addictions. So it cut down the pathway. In the stomach, it slows down your stomach emptying, so food stays in the stomach for longer. So you don't feel much hungry. And on the top, it also causes release of insulin. Now, these are the signs. What you feel as a patient is, after eating few bites, you feel full. So you're not eating much. So that's what happened. Your body is a constant low calorie state. But you know that your body is a machine. It needs energy to function. It requires about 1500 to 2000 minimum calorie to just maintain the life. So say for example, you are not eating much, you're eating only 1500 calorie. Where from the extra calorie will come from? Those calories will come from your stored energy, which is fat. In that way, you slowly trim down over time.
Who is a good candidate for semaglutide and tirzepatide?
Very good question. Semaglutide and Tirzepatide has a wide range of indication. Only two type of patients cannot take semaglutide and tirzepatide, actually four, sorry. One is if somebody has a family history or personal history of thyroid cancer, if somebody has a previous attack of pancreatitis, if somebody is pregnant or going to be pregnant, and if somebody is on cancer chemotherapy. Although the thyroid cancer is not proven in the human, it was found in the rat model, but we always be careful not to give anybody who has a family history of thyroid cancer. Danny.
What are some common side effects?
Again, these medicines are amazing medicine. It's only once a week shot, very well tolerated. The common side effect, like every medicine has side effect, it can cause nausea. First few weeks, most of the time it goes away with continuous use. But if it's really too much, then obviously you can take Pepto-Bismol, you can take Dramamine. If it's way too much, you can always write for some Compazine to control the nausea. Second side effect, it can cause constipation. And these side effects, you have to understand that these are not for everybody. Only 10 to 15% folk have these side effects. Rarely you can have some abdominal pain. It's 0.3%. It's a very, very rare. That is almost, I never saw any patient of mine, but these are the common side effects.
How long does it take to see results?
everybody varies. As I say that, I saw somebody with a one shot, 1 week lost 8 pounds. It usually take about 2 weeks to be understanding, it's like normally about 2 weeks to see the result, and then it just goes on.
How long can you be on semaglutide or tirzepatide?
This is another huge benefit of this medicine. Before this medicine in the market, our only option was phentermine, which is a good medicine, which is since 1990s this medicine is in the market. But phentermine's problem was that after 3 to 4 months, you have to hold the medicine for at least 1 to 2 months. You cannot use it continuously. Semaglutide and Tirzepatide, as per FDA, you can use it continuously as long as you are losing weight in a healthy way and you're not becoming undernourished or underweight.
Do I still have to work out while on semaglutide or tirzepatide?
It's always the best option. When you come with the weight loss, you have to understand there is a diet, exercise, and medicine. Exercise has lots of good things. It's not only for weight loss. It increases your cardiovascular, it improves your bone health, it makes your brain sharper. So there is a lots of benefit. Yes, we still recommend everybody should do workout. Usually it's recommended about 150 minutes a week or 30 minutes for 5 days. You can take 2 days off. Should not take 2 days off back to back, probably 3 days, 1 day off, 3 days, 1 day off. But that is the best way also to add up with your medication.
How much weight can I lose?
Very good question. Very often I see some of the clinics, as you understand or see, there are a lot of clinics of the weight loss like mushroom. And people also get it online without proper guidance. And these are the clinics just encourage you to lose weight. You have to understand, if you lose more than 3 pounds a week, you're losing muscle. Muscle is your body's one of the very important assets. It takes a lot to build muscle. So if you lose muscle, what happens? Number one, muscle makes us to move and stand and function. So if you lose a lot of muscle, you'll be so exhausted you cannot function. You cannot even walk. You cannot even go up and down. You can't even stand up. Second, you have to understand our heart is also made of muscle. If you lose too much muscle, that can also affect the heart function also. And number three is with this uncontrolled weight loss, obviously, if you lose more than 3 pounds or so, you are getting a skin laxity. So we do not recommend more than 3 pounds in a week. So if somebody is losing more, we always cut down the dose, or we do not go up on the dose if somebody is losing in a controlled fashion.
Are there any other benefits to semaglutide and tirzepatide?
There are a lot of benefits. This is a newer medicine compared to other medicines, so we are not getting all the benefits yet. There are lots of study going on. Number one, it reduces your cardiovascular risk about 15 to 20%. Number two, if somebody has some other addiction like smoking, gambling, alcohol, it helps to prevent that. Sometimes this year is going to be also approved for the opioid abuse disorder. It also is very anti-inflammatory. So if somebody suffers from like rheumatoid arthritis, somebody from the Hashimoto's, they also get significant benefit. It also prevents you from developing Parkinson and Alzheimer's disease. And as I say, there are more coming on. So we'll probably get a few more benefits that we know down the road.
Okay, that's all my questions. Thank you.
Thank you very much. Pleasure to have you.